Okay, Ben, whenever you are. Yeah, hello. Very warm welcome to all of you, wherever you might be tuning in from. KDRTV Live. Right now, it's 6:07 Central Time here in the United States. As always, very delighted to have you on our show today. We're going to engage in yet another interesting conversation that revolves around the COVID-19 that has really ravaged not just the state of Minnesota, but also has ravaged the people across the country and around the world. So today we're going to engage in another conversation on the same. But before then, I just notify you that tomorrow, the Mong'are organization, this is the largest Kenyan organization here in the state of Minnesota, will have a distribution and free COVID-19 testing sponsored by the Hennepin Healthcare Department, and that will be tomorrow. And I think, as you see on the show, on the flyer there, please feel free to go there tomorrow, and then you can get free COVID-19 testing. I think that's very important for us to make sure that we take care of ourselves during these very uncertain times. But before then, we are very delighted to bring on the show a number of African leaders within the state of Minnesota who are going to engage us on what's really happening around their communities relative to the COVID-19 pandemic. And we did talk about Hennepin County last week, but today we're going to switch focus and see what is happening in RAMSEY County. And in RAMSEY, the theme of the conversation will be all about African leadership in the COVID-19 pandemic, and we're so much honored to bring these wonderful brother and sisters to lead us in this conversation. So delighted to have Pastor Loveth Aligbe and also Dr. Felicia Ikebude and my good friend Dr. Mfon Archibong, who will be leading us in this discussion. But ladies and gentlemen, it's good to have you on the show. May I start by saying that you all look great. Good to have you on the show. And then we go straight to the introductions for the sake of our viewers. I want to start with you, Pastor Loveth, if you don't mind introducing yourself to our viewers.
Okari, for inviting us to this wonderful segment. My name is Pastor Loveth. I'm the senior pastor of the Ark of Covenant Ministry in Brooklyn Park, Minnesota. I'm a public health professional, community influencer, and the anchor of the Voice of Hope. With Empire Entertainment Smile, a media agency that promotes community engagement, outreach, and education. We organize events to promote awareness in the immigrant community through our social media platform, YouTube, Facebook, and all of that. Thank you.
Thank you very much for that wonderful, short, and very sweet introduction, Pastor Loveth. Great to have you, and welcome to KDRTV Live. So also honored to have on the show Dr. Felicia Ikebude, if I pronounce that well. Welcome to the show, and for our viewers, please introduce yourself.
Thank you. It's a pleasure being here today. My name is Dr. Felicia Ikebude. I'm a nurse practitioner with Hennepin Healthcare, and I'm the president of the Nigerian Nurses Association here in Minnesota. Our organization is involved in the community. We do a lot of, community health education, wellness. We promote, healthcare and health education within our community. We do a lot of outreaches. We've been involved in a lot of education during the COVID pandemic, and we're here to talk about, how we can help our people get all the resources they need during this pandemic. Thank you very much.
Okay, thank you. It's good to have you on. And again, apologies, looks like we're having some technical difficulties with Dr. Mfon Archibong, but he will be joining us momentarily. Our technical team is working hard to make sure that we bring him back to engage in this conversation. So let's get to this conversation. I think let's start with you, Pastor Loveth. A few months ago, we didn't anticipate this, but it's a reality that we have to live with, right? Here in the state of Minnesota, we're having this problem. It's happening across the country, and now it's happening all around the world. It's really interesting. Maybe from your text, why do you think this is happening around the country and indeed around the world?
Oh, thank you once again, Dr. Okari. I think why we are having continuous surge in the state of Minnesota is that people are becoming very complacent. They are not following the CDC guidelines, the rules. They are, especially in our African community, people are still having little gatherings, party. They are not social distancing. They don't know that COVID is real. A lot of people that we know that are close to us in the community have died. So that's why this education is very important, and the awareness in our community so that we can mitigate the spread. Thank you.
Thank you, Pastor Loveth. Actually, Felicia, this is not just in the state of Minnesota. Just to be fair, I think some people might assume this is happening in Minnesota, but it's not. Actually, it's happening around the world. I mean, I see it is happening in other states. It's happening in Europe. Actually, I was reading the news today that the French President Macron is really having a very hard time. In my home country, I was reading news about some of the prominent people that even have died. Why do you think this is happening also around the world? Why is it not ending?
The issue is people are tired. They call it COVID fatigue. And then people are going back to work. You know, when this thing started, the whole world was shut down. And now people want to go back to work. Kids are going back to school. And, you know, people are a little bit more complacent than they were, or kind of like they're no longer afraid. But that is why the surge. People are traveling again, you know. So, and COVID is not a respecter of any human being, and it spreads like wildfire. Once somebody gets it, it spreads so fast. So that is why it is spreading. People are tired. They want to go back to their normal life. But we still need to educate our people and tell them that, you know, until everybody gets vaccinated and we study more how it's going to work, please, we still encourage people to, you know, do what they need to do to stop the surge of this virus.
Okay, very good. Thank you. Pastor Loveth, let me bring you in. I think for the sake of our viewers, so that they understand, let's put it in context. RAMSEY county ratio, equity, and community engagement. Could you mind putting that in context for our viewers? What does that really mean? Who is that group, and how relevant is that to this discussion?
Thank you. RAMSEY County Racial Equity Engagement is mainly for the African community, or the community that has been disproportionately affected by the COVID, which our community is one of the, and money is being set aside. We are the community trusted messengers to go into our community and bring the messages to them day in, day out, as we get these messages from RAMSEY County, the CDC, and whatever resources RAMSEY County have available. We are the trusted messenger that bring the resources to them, how to get tested. If you are being affected by COVID, where to go. They will help you to pay your bills, your rent, your mortgages, and everything to make sure you are not evicted from your home, so that you can continue to live your life. So that's what racial equity is all about.
Okay, thank you. And I know, Felicia, you do also, what's Grace Restoration?
Is a non-profit organization. They are trusted messengers in the community. So they are being contracted by RAMSEY County to deliver this message we're delivering today, to tell people that there are resources available for them in RAMSEY County, those who have been impacted by COVID. We're going to tell you those resources that they have available for you. We encourage you to call RAMSEY County if you live in RAMSEY County and having a hard time now due to COVID. They have a lot of resources to help you at this time, because people are really hurting economically, mentally, and otherwise. So Grace Restoration is one of the contractors that is working with RAMSEY County right now to bring this message and resources to our community. Thank you.
So thank you both of you for putting that in context, and of course on behalf of our team here at KDRTV, many thanks for coming on to use this platform to pass that message. And again, many respect to Grace Restoration. You guys are doing fantastic job, not just on this platform, but I think you've done a lot of good work for the community, and also by extension, we appreciate Ramsey County for doing that for our community. So let me stick with you, Felicia, for a moment. And when we talk about community, what do we really mean, and who are we targeting here? I think we're talking about the immigrant population. Here, we are not necessarily talking about. We have Kenyans, we have Somalians, we have Nigerians. We really have pretty much every immigrant from the sub-Saharan African region.
Community, we are talking about African community. People from the east, like the Kenyans, Somalians, people from the west, Nigerians, Liberians, who live in Ramsey County. We all know that, one thing I always tell people is that COVID has really, really opened a can of worm to the disparity, to the injustice, to the health inequity that people are experiencing, especially our African communities who are immigrants, access to healthcare. And, people are dying from COVID. They say we have pre-existing condition. We're not just dying because we're Black. We're dying because we are not getting the right health care that we need. And this health inequality and disparity has caused people to have a lot of pre-existing conditions like hypertension, diabetes, name it. And when you have all these diseases and then on top of that, you get, impacted by COVID, then your chances of survival is very, very slim. So that's why we're bringing this message. When we say community, we're talking about our African community.
Thank you again. I appreciate that. Again, for our viewers, if you're watching this right now and you have any question and or comment for the panelists, please feel free to do so, because we are streaming live on Facebook. You can go on Facebook at KDRTV.com. Post your question there or comment. We'll love to appreciate that. We're also on Twitter at KDRTV Live. If you could and you want your question answered, please post your question there as well. We are on YouTube. If you could as well, as you do so, subscribe. Let me get to you for a moment again, Pastor Loveth. It's interesting. There's what we call African socialism. I think people in the West may not understand what that means, that African socialism, we really like really seeing one another as one, regardless of the situation. What are some of the key reasons as to why you think COVID-19 is spreading in our community?
Reason that is spreading in our community as Africans, we like togetherness, we like to come together, we like to worship together, to socialize together. African community is always family oriented. We like to look out for each other, and we always believe that, oh, it's my sister, it's my brother, it doesn't matter. But you don't know who is who, because now the problem we are having now is the asymptomatic carriers. They don't show no signs of COVID-19, and the only way we can stop this is by wearing our mask. Don't come together, especially this holiday season. It's very hard. We love coming together as Africans, visiting each other. So what we can do this holiday season is to celebrate differently in our various households than coming together, having large parties and socializing together during this holiday season. That's the only way we can mitigate the spread. We don't want anybody to die because we love each other.
Okay. Very good. Thank you. I'm going to bring in Dr. Felicia Ikebude and remind our viewers that you're not just a panelist, that you are a nurse by profession. And in addition to you being a nurse by profession, you are the president of the Nigerian Nurses Association. That's really powerful, because when you think about it, a good percentage of our immigrant population really are in the healthcare industry. So you really speak on behalf of a lot of people. Now, that's from the professional part of it, and also involved in community. Do you have any additional reasons as to why we have that spread within our community? And if any, what should we do to mitigate that surge?
Thank you, Dr. Okari. So you said something about, African socialism. Telling a story, how we gather, we eat together, like in the same plate, in the same pot. We can all sit together and talk. So when we gather that way, if somebody has COVID, we're going to pass it from one person to another. So we need to have a behavior change from the normal to the new normal. So what we used to do before, we need to desist from that and try to, kind of protect yourself, because when you're protecting yourself, you're protecting your neighbor, you're protecting your brothers and your sisters, you're protecting your family. So we know we love each other. We want to celebrate together. We want to, gather and brotherhood and sisterhood, one family. But I say at this time, especially during this Christmas holiday period, please, I encourage you that if you want to celebrate, just celebrate with your immediate family members. That's one way we could, really stop the spread of this virus until we get, a hold of it and control it. So, we love each other, but let's try also to be our neighbor's keeper by protecting ourselves. You do your part, I do my part, and we will all come out for good from the COVID. Thank you.
Okay. Thank you. Dr. Felicia, I'm going to stick with you for a moment before I get to Pastor Loveth. A friend of mine who's a nurse, and I want you to speak directly to particularly those healthcare workers within our community. So went to work, came home and had an elderly parent, and for some reason the parent got COVID-19 and unlikely passed on. Now, she's very guilty of the fact that she feels she's responsible for her dad's passing. What do you say to healthcare workers within our community? Yes, they have to do the good job at work, but at the same time come back home, be parents, be brothers, be sisters. What do you say to them today?
My heart really goes out to, that sister of mine. It's so hard, and really, my prayers are with you. But I want to tell us something as healthcare providers, our brothers and sisters who work in the healthcare industry. It's very, very hard, even at this time, because thinking it's like you going to a war zone when you are at work. And after doing all that, you come back home and you're afraid, what am I bringing home to my family, to my loved ones? So I would say don't take it personal, but what we'll do is try to protect yourself. When you go to work, at the beginning we were telling people maybe you should strategies like, removing your clothing in your garage, or, going straight to the bathroom, remove your clothes, shower and change before you start even mingling with your family members. Those are some of the things you do. But I know that we are so overwhelmed with, the consequences of COVID. A lot of us are so burdened and burnt out. It's okay to seek help if you know that mentally you cannot bear it. Please seek help. Don't feel guilty because of what happened, because a lot of us we have gone through this. It's a lot and it's still going on. I encourage all of us to be very, very vigilant at work, and when you're at home, also be vigilant. Do not take anything for granted. That's what I always tell people. And continue educating people around you that COVID is real. And, the bad side is that somebody might die, but we don't pray that it happens. So that's my message for all of us. Thank you.
Thank you, Dr. Felicia, for those encouraging words. Now, Pastor Loveth, when COVID started, most of us, including myself, didn't think it was going to be a major issue, but it actually did. Now, thousands of people have died, and I remember the Prime Minister of Italy saying, "We've tried it on earth and it's failed, so we have to look up to the skies for guidance from heaven." You are the pastor. You know well that whenever these things happen, we all of us run to the pastors. From your take, in all honesty, as a pastor, what do you say to people, particularly in our community? They know they want to run to the pastors. The kids are home, they need to play. We need to meet for weddings and funerals. What do you say to them, particularly coming from a pastor?
As a pastor, we do encourage people. According to the word of the Lord in 1 Thessalonians 5:16, he said, in every situation you find yourself, give thanks. It could have been worse than this. We are still here is the grace of God. We have loved loved ones. We continue to encourage them to trust in the Lord, that the Lord God Almighty will continue to protect them. Because when everything fails, the Lord God Almighty does not fail. The pandemic, everything has failed. Science, everything, but God is still the only one we can run to. And as Dr. Felicia said, we have done so many things, behavior change. We worship now online, most of our worship. And when we worship, we are worshiping at 25% capacity so that we can mitigate the spread by not coming together like we do before. So even the elderly, the vulnerable adult, I'm a public health nurse by profession. I work in the community, especially in the African community. I love to see my client, but because of the executive order, we have to do our assessment, visual assessment. You still want to do that one-on-one, but this is not the time. When COVID is over, we can still see our client and still do the necessary thing.
Okay, thank you for that. And again, many apologies. Seems like we're having technical problems with Dr. Mfon, but hopefully we can get him before the end of the show. And I want to stick with the two of you for the time being. Felicia, you being a nurse, and I'm sure many thanks again to you, Grace Restoration and RAMSEY County, for this wonderful engagement with the community. People are saying, well, it's a holiday season. By the way, as a professor, classes are ended today, so I expect to sit at home and have fun with family, and everybody is doing this. But we are talking about testing. From RAMSEY County, you talk about resources. Where can people within RAMSEY County, where I live, where can they go for testing now, during, and after? And if you could as well, what should we expect when we go for testing?
Thank you for that. So in RAMSEY County, they have a lot of different testing sites that you can go to and get tested. If you call their number, they have a general number you can call. It's 651-266-3800. And they will give you information to the different sites and the different times that they get testing. Usually they work from Monday to Friday and then some weekends. So they have that. That is for the sites. Then if you go for those tests, you do not need to have insurance. They don't ask you for money. It's free, and they don't ask you for ID. All they ask for is the basic information, your name, maybe your phone number, so that they can call you or maybe email you with your results, usually in 24 hours or so. So with these festivities that were going on, so they encourage you that, if you're gonna gather with people, it's better you get tested before and watch yourself before you start gathering with people. And then after the festivity, they also encourage people to test to make sure that, since they've gathered together, which they discourage, we discourage it, please. You get tested to make sure before you start going out again, to make sure that you test negative. But we overall discourage people from gathering. We want you and your immediate family member to celebrate. And then, there will be many Christmases to come. So let's do it right this time and, mitigate this spread of this COVID virus. Thank you.
Dr. Felicia, there's something that is going on in our community. We have professional doctors, but yet there's another interesting doctor in our community. I wonder what you have to say. And that doctor is called Dr. Google. A lot of people are going to Google and finding answers to every single problem surrounding COVID-19. What do you say to that? You're coming from that field.
In as much as, people go online to search for Google will not give you the direct answer to some of your questions, or sometimes they go overboard. And you are looking for something simple, and Google will give you something very, complex, and your mind will begin to wander. So I encourage people, as much as they like to Google, but I like you to talk to your medical professional, your healthcare provider, They will give you the best advice. And most times, the things we worry about, they are just simple. Instead of, after we Google, we're having heartaches and all that because we're thinking that something very, very serious is happening to us. Why? It's something simple. Please, if you are in doubt, please call your healthcare provider so that they will talk to you. Thank you.
Thank you. And I think, and again, many thanks to you, Felicia and obviously. If you have any questions, again, please go to our hashtag KDRTV Live. If you want the panelists to answer any question and or comment, please do so, and we'll be happy to share that with them later. Pastor Loveth, I'm going to come to you for a moment for another interesting part of it. African socialism, again, and I underscore that African socialism. You are the pastor, you look at it from a more spiritual perspective. There is stigma associated with almost everything whenever somebody in an African situation really falls sick. And in this case, the data is showing, quote unquote, if you have a pre-existing condition, then it's corona. I think now people got to a point where they're not taking that serious. They think everything is corona. And that's bringing a lot of emotional and psychological torture to quite a number of our people. Now, there are people who, in our households, in the basement, we have our parents who are staying there. People are so scared because maybe those elderly parents are really having corona. What do you say to our people in the community in terms of fear, mongering, all the stereotypes that are associated with COVID-19?
The stigma is, we try to take more education, as Dr. Felicia said, because it doesn't matter whether you have COVID, it's listed, people are just quiet, they don't want to say it, they don't want people to know. For you saying it or you going to test, you have helped somebody. That your grandmother living in the basement, your brothers, your sisters. We tell them COVID is not a stigma. Now we are happy, a lot of medicine are there that can help us now. Once you feel sick, go get tested, go see your healthcare provider. They will know what's next for you to do. If you are not sick enough, they will tell you to be home. They can call you, the Department of Health, the tracers, they will call you to monitor and see how you are doing on a day-to-day basis until you are off isolation or quarantine. So that's the education. Even in the church every Sunday, we let them know. If you have been exposed, please get tested in your community. There are various testing grounds everywhere in the community. Thank you.
Okay, thank you. Again, I want to stick again with you, Pastor, because at the end of the day, yes, we go to the doctors, but at the end of the day, we run to the pastors. And I'm sorry, I'm going to put you on that seat again. I want to try to segment our immigrant population. We are different. The way the African woman looks at things is really different from the way a man looks at it. But women are more emotional. They can quickly acknowledge a problem and probably run to the pastor or to the doctor for assistance. Now, if you are talking about the African man, which includes myself, we have that strong man mentality. COVID is not for me. But really, when it hits one person, man, child, or woman, it's really detrimental. What do you say to men, especially who might say, you know what, doesn't affect me. I'm a strong African man.
And there is nobody, COVID is no respecter of anybody, doesn't need a ticket, visa to travel to be in your household. It's just a lifestyle change. We all trying so hard to wear your mask, be where you need to be, don't be in a crowded environment. It's not if you don't wear mask, there was one article I saw, if you don't wear mask, you will end up in the hospital with a ventilator. So I think it's easier to wear mask than to end up with ventilator. And even in churches, I tell them everything is not prayer. COVID is real. Do what you need to do so that we don't continue to pray for 40 days and 40 nights. Thank you.
Yeah. That's so powerful, Pastor. I'm feeling like I'm in church already. Thank you for those. That's very encouraging. Now, both of you, and I'm sorry to assess you're very calm, professional, successful, and really motherly in approach, the way you're doing these things. All about we are parents. But there's a segment also, if you don't mind talking to, that is fairly difficult to deal with, and that is the young people. Right now, the young people are told COVID is not for young people, it is for the elderly. So if you cough, they think you have corona, but then they think you're going to go have a party, go hang out with friends in the basement and the likes. Now, take this opportunity, Felicia, begin with you, then Loveth. What do you say to young people and the children relative to COVID-19?
My message to I have young teenagers at home. We play basketball. We now told them we have to be careful. This is not the season. We can go out and party next time once we are able to mitigate this spread. Once the vaccine is out and everybody is taking it, because the young people believe, as you said, doctor, that the COVID will not affect them. But we've seen now in the state of Minnesota the rise in the cases of the young adults. So they are the ones that are the asymptomatic, carrying it everywhere. There was a story, a grandmother never left home. She always home. But the grandchildren, they are the ones that are up and about. She got COVID. So they asked, where did you get it? She said, I never left the house. So definitely it's the young adults. You don't want your grandmother to die. You want her to live for a long time, for you to be there as a grandchild. So what you can do for her is to show love and stop and change your lifestyle by coming home and not being in the crowded environment, hanging out with your friends and your loved ones in their basement, or doing anything otherwise. Let's follow the rules of the CDC. Stay close to home. Wear your mask in the public and give 6 feet social distance. Wash your hands whenever you go out.
Thank you, Felicia. The same question, and we're talking, but it's a fairly difficult group to deal with. But at the same time, as parents, we really have a responsibility and professionals to guide them. Now, what do you say to them in addition to what Pastor Loveth is saying? And then second, if you don't mind, in the introduction, you saw that flyer with the Kenyan community. They're saying Hennepin County has resources for people who have been affected. So yes, that's the first question. Then second question, are there any other additional resources from RAMSEY County for people who've been affected with COVID-19?
Thank you very much. I think with our youth, what we keep doing is education. And another thing we need to do, sometimes we need to actually call them and ask them their own perspective, what they think about COVID, because sometimes some of them understand, sometimes some of them, they do not. Call them, put them on the table and ask them, what do you think about COVID? And hear what they have to say. Because a lot of them do understand, but sometimes they think, they're invisible. But if you have a discussion with them and you hear where they're coming from, and maybe sometimes their perception might be wrong, that is when you really correct it. But if you know that they know what they're saying, they know the right thing, all we need to do is encourage them and, kind of sink it in and tell them that you're doing the right thing, keep doing what you're doing. It's all about behavior change, so that they keep doing what they're doing. They are all going back to work. They are, going to school. I know now that they're back home, but now they're hanging out with their friends in the basement. So we keep talking, educating them, and letting them know that, you don't want to hurt your grandma or your grandpa or your friends, just make sure you do the right thing. That's on that side. The resources available for people who have been impacted by COVID in RAMSEY, they have food delivery. If you call them and you tell them if you have COVID and you can't go to the store, they have this program. They can deliver 3-day meal, 7 days a week until you get, finish your isolation at home. They have that. Some people are kept in the hotel until when they finish their isolation. They have a lot of resources for food. They have shelter for women and people who have been impacted with mental health concerns and all that. So a lot of resources. Is just call them and they will give you direction to, where you can get the help you need.
Okay, good. Pastor Robert, you want to add on to the same question? And again, I was in a function last week, and many thanks to the Kenyan group. They're also providing this. who actually deserves this? Because I think some people feel, oh, you know what, it's not for me, or looks like you're desperate. Why are you going for this? Who really should go for those resources? Anybody or somebody's need? And what is need? How do you define that?
I think the people that really go for this is people that have really been impacted, because if you're going to be in quarantine isolation for 14 days, you are not going to get paid from your job. Your bill's going to pile up. And we have had opportunity to work with the city as well. You know, we did a COVID relief sometime in October for the city of Brooklyn Center. I know people that have been impacted by COVID, and we as Africans, we are very proud. We don't like to take anything from, even though we are dying. We started reaching out to them. Now, this thing is available. I know you need it. If you need help to fill out the application, we are here, because they were able to pay your bills, your rent, you know, and even our food voucher to be able to buy food, because we told them our people need culturally specific food that they love and they eat. So these are the people that really need it, because we have been disproportionately affected as African people, especially the immigrants. So we encourage them that these resources are available in all counties, whichever counties that you live in. Reach out to the county and they will make sure you are well taken care of. Thank you.
Good. Okay, so good. Felicia, do you know if there is any coordination? We know we talk about community. Sometimes people tend to say, "Oh, community. What does community mean?" And I think the way we know African communities within a country, there are different subgroups, right? So, for example, my home country, there are many groups within that country. You go to Nigeria, within Nigeria, there are different groups. Somalia is a different group. But we're really talking about the immigrant community. Do you have any knowledge if there is any coordinated effort within the African community leadership towards really dealing with the COVID-19, if any?
Thank you for that question. I know there are a lot of collaborative efforts from different African communities to work together to, help communities who have been impacted by COVID. Even though some communities tend to do it, different in subgroups in different countries. I know when the CARE Act, they set aside some fund for colored and African immigrants. So why there are no coordination, as in formal coordination? A lot of these subgroups in African community, they go out and get these resources and bring it to their immediate community. So that's what I've been saying that's been happening. But I will really encourage, since you brought that up, I will really encourage that, other communities from Nigeria, Kenya, Somalia, we all come together in unison, collaborate with one another, and speak in one voice to bring these, resources to our people, because it's very, very difficult for our people to source these, resources. If we're not speaking for them, nobody speaks for them. And like you rightly said, people are proud or people are ashamed to seek these resources. But I tell you, this fund have been made available. If we don't use it, we will lose it. And if they find out that we are not using the resources that have been set aside for us, they will take it back, right? So I will encourage our community leaders from different countries to come together, speak one voice, and demand it. That's what I would say. Demand these resources so that we can help our communities who are being impacted by this COVID. Thank you.
Think for taking the initiative to really go find the information, because I think one of the greatest problems that we have is that our people lack information, and because if you lack information, you're not going to act. So, leader, I appreciate you for making that effort, getting that to us and our people, and of course, on behalf of our team here at KDRTV, I'm so honored to have you on, and obviously in the future we are very happy to partner with anybody within the immigrant community so that we can really communicate in the most effective and understandable language to our community. So again, that's an extended invitation to that. Now, I just received a text message for you, Pastor Loveth, right? So they're saying, so you have the pastor on the screen. You keep talking about, so it's an accusatory statement, talking about social healthcare workers, children, but we don't seem to talk about the elderly who are in the basements. Some people, and I know some have said, I need to get my parents go back to Africa. I don't want stress right here. So do you mind, as a pastor, talk directly to our parents who are in the basement, who are so worried that they're being alienated or they're in danger of this COVID-19?
Everywhere, our loved ones, that they should just be patient, follow the rules. I know they are scared of their family, their friends, their loved ones. People are not coming because our community, my mother loved people coming to visit her. So I imagine if she was alive. So I tell people, this is not the time for you to be visited, but you can communicate with your family, your loved ones via the phone, other media, using a Zoom to see them, and FaceTime. Because like the city we live in, they were able to give about 40 iPads to the seniors so that they will be able to communicate with their loved ones, because they cannot go out because of the COVID. And my message to them is like, let's continue to trust in God and let's believe in God for protection. God has brought us this far. He will not leave us. He will not forsake us. Thank you.
Good. I think it's an honor to have you, really having two professionals from two different perspectives, the nurse and the pastor. Wow, that's encouraging. And of course, many apologies to Dr. Mfon because of technical difficulties. We may not have him, but I know he's a wonderful person. He's a good friend of mine. He's done incredible work to our immigrant community. Hopefully we get him. If we don't, we'll do everything we can so that we can have him on the show next time so that he can also share his perspective. So for those who are anticipating Dr. Mfon, many apologies, I think, because of the technical problems. So here have another additional question. I don't know, both of you, if you could, that's okay, but if not, we can have this for next time. So Laban Mbade is asking, will these resources affect our tax returns? Some of us are very scared of the same. So the people are saying, yes, give us those resources, but it's going to affect my taxes and I don't want to do that. Do you have any thoughts on that, Dr. Felicia?
Thank you for that. I will categorically say no to that, because it's CARE Act. It's free money that the government has set aside for the purpose of COVID. If you get any resources related to COVID-19 from the CARE Act, it's not going to impact your taxes in any way. That's all I can say, and I'm sure of that.
Okay. Thank you. We appreciate that. So, and then if you want to add the same, that's okay. Pastor Loveth, another question. Okay, for our viewers, thank you. I see there are so many questions coming, and obviously we're running out of time. If you could, feel free, go to our handle KDRTV Live, post your questions and comments there. What we'll do after the show, we'll put those questions together and forward them to the panelists, and then we can have another show next time so that they can tackle those questions. And I think, thank you so much for engaging this conversation. Yet another question comes from Margaret Loom to you, Pastor, and I think both of you can answer at the same time. So how long are they going to pay our rent?
We see round of the CARE Act money coming, first round, second round, third round, and they say if you have applied before and you still need help, you can still apply. If you are not working, you are still unemployed, you can still get it. Or if you are still sick or somebody in your household is still impacted with COVID. So that's what we are hearing and what we are seeing. The CARE Act fund keep coming back over and over again. Thank you.
Okay. Oh, thank you. So on a light note, before we finish the show, I think it would be unfair not to focus on the two of you. Yes, thank you for the great job. You're representing RAMSEY County greatly. Grace Restoration, many thanks for what you're doing. But for the two of you, I didn't ask this question. You look great, right? I was trying to test out and see how you are doing. I think so far you've done excellent. Some of us are very stressed because of this COVID-19. Let's begin with you, Dr. Felicia. What keeps you going during this difficult time?
It's called self-love. I've learned to love myself better than any other thing, because when you love yourself and stay healthy, you'll be able to love and care for other people. You cannot give what you don't have, right? So I try as much as possible. It's been stressful, especially, working in this time. We're being pushed to work even harder. So at my spare time, I try to reflect, what I've done good. I mean, what I've done well and what I can change. The ones I cannot change, I throw it into the back burner, because,
Oh,
I don't want to deal with them, because dealing with them will cause me more stress. So I've been doing a lot of self-reflection and taking care of myself as much as possible, drinking a lot of water, exercising a little bit if I have time. Not enough sleep, I will confess, but try to be happy and thankful. It's good to be thankful, because it could be worse. We go out there every day, we see a lot of stuff happening. People, I mean, literally dropping, I would say, but God has been so faithful. We're alive and standing. It's by His grace. So that's all I've been doing to keep my heads together. Thank you.
oh, thank you. Thank you, Dr. Felicia. Keep doing it. I've learned something today. Laugh myself, and I want to try to focus on that at the same time. So, same question to you, Pastor Loveth, and being a pastor from Grace International. Obviously, our viewers will really want to hear what the pastor is going to say, got to say about
Yeah,
this.
during
Go ahead.
Yeah, thank you. During this COVID-19, because we have been on lockdown and not you don't really go do much out there, I've learned to pray more. It has brought me more closer to the Lord, which I'm very, very proud and happy. And because people depend on me as a pastor, my community, and my members. So I've done a lot of things, praying and interceding on their behalf, and working as a trusted COVID messenger for RAMSEY County. I've had the opportunity to meet a lot of people and impact people's life and bringing the resources to them wherever they are. It has given me sense of joy and happiness, because that is the main thing. As a pastor, my work is beyond the pulpit. It's when you are able to impact life according to the word of the Lord. What have you done for me? So I'm able to do that in this recent time. This has been the greatest time of my life, being able to impact and make other people happy. And I will continue to do that, take good care of myself. As you can see, I love myself. As Dr. Felicia said, self-love is the ultimate. We do that, is our thing. So we are happy we are able to do that. Thank you.
Okay, thank you, Pastor. I didn't tell you that today is my birthday. That is the
Wow.
best message. That's the best message I got today. I mean, spending time with the two of you, it's incredible. And I think I take that message very seriously, and I can only say many thanks to you. So, in closing, if you don't mind, Dr. Felicia, you have 1 minute. What is your message to our community? We're heading to the holiday season. What's your closing statement?
Been a pleasure being on your show today. And I just want to say to, our communities, please, we want to celebrate. Please be safe. Continue doing what you have been doing since the COVID started, and now continue. The vaccine is here. Please be prepared to take the vaccine. I was supposed to take the vaccine today, but I'm going to take it on Monday. Please, I beg you, if you have time and when it's your turn to take it, absolutely do take the vaccine. It is important. Actually, for me, I take it like a civic duty. Even though it's going to help me, I'm going to use it to help other people, encourage them to take the vaccine. Celebrate with your immediate family members, and let's kick COVID out of the universe. That's my message.
Okay,
Thank
thank you.
you.
Thank you, Dr. Felicia Ikebude. And then closing statement couldn't come from a better person, Pastor Loveth.
Okari, for inviting us to this TV show today. We are happy to be here. My message to my community: continue to do what you do. Celebrate quietly with your household. Don't get into the crowd or having large parties or visiting other people. Like me, I'm a grandmother. I've not seen my grandson. He was born during the COVID. I understand. It pains me, but we have to do what we need to do to protect our family, our loved one. As a nurse, that is my message. You can protect. You wearing your mask, you washing your hands. There are more parties, there are more events. As we need to mitigate the spread, we need to kick COVID out of our universe. It depends on you and me. And above all, we need to continue to pray and ask God to take control, and He will surely do. Thank you.
Okay. Wow. Very well said. I think that will mark the end of our conversation. I think I'm going to say many thanks to you. Thank you for coming on the show. But more importantly, thank you for what you're doing for our community, and thank you for all you will be doing going forward. And extend our invitation that KDRTV is a platform for you. If you want to come on and share your thoughts with our community, because the goal for us here is driving a positive diaspora narrative. I think, as I had a conversation last week with the former ambassador to the UN, Dr. Okari Chimbori, what we said is, well, if you're not on the table, you're on the menu. If you're not on the menu, you're under the table. And then we said, no, that's not the point. The point is, we don't want to be on the menu. We don't want to be under the table. We need to create a table of our own. And this is a table we're creating so that instead of going to CNN or otherwise, we can use this platform to communicate. So again, to you, many thanks, and feel free to come next time. And of course, Dr. Mfon will get you back on the show sooner than later. For you and your families, have a happy holidays, and we'll talk to you soon. So, and our viewers again, good. And for those ones who are watching right now, please stick around here. In about 15 minutes, we're going to have yet another show. That show will involve two wonderful African immigrants here. Professor Peter Ndiangui is in down South Florida, and Attorney Labano Pandit down in Houston, Texas. They'll be on the show momentarily to talk about why being a male feminist is important or is empowering. That's a very fascinating conversation, particularly when you consider the issues that we have at family level and beyond. So again, if you could stand by for another 15 minutes or so, please come on the show, come on back so that we can engage in that conversation. Again, I can't forget again to remind our viewers, if you could again tomorrow, Mong'are organization, this is the largest Kenyan organization here in the Twin Cities or in Minnesota, will be doing a distribution and free COVID testing tomorrow. If you could please do so, join them. I think this is good for you. Again, it will be on Saturday, December 19th, tomorrow, 12 noon to 4 p.m. And that will be at the Brooklyn Park Community Center. I think the address you have there, and that is in partnership with the Minnesota Hennepin Healthcare Organization. So again, to the Mong'are organization under the leadership of Hulda Momani. Many thanks. We hope people do join you tomorrow. But for now, thank you for joining us, and see you again in about 15 or 20 minutes when we host Dr. Ndiangui and Labano Pandit.